Wondachew Adisu, a clinical nurse working in southern Ethiopia, helps to unload mobile lab equipment and other gear that he and his team members will use to survey villagers who are at risk of neglected tropical diseases. The survey will enable the Federal Ministry of Health to determine the most effective treatment plan. According to Ethiopia's Ministry of Health, close to 75 million people in Ethiopia are affected by neglected tropical diseases.
በዋናነት እየተሰሩ ያሉ አራት የአንጀት ጥገኛ ትላትሎች ናቸው። እነዚህ ቺስቶሶሚያ፣ ሁኮርም፣ ትራይክሩሲስ እና አስካሪሶች ናቸው። ለዚህ እነዚህ አሁን ላይም ባለው ሪሰርች ከላቦችም እንደምንጠይቀው መረጃ በወረዳችን እየተገኙ ነው።
First stop for the four-member crew is a primary school, where the two lab technicians set up a mobile laboratory. At the lab, they will analyze stool samples that Wondachew and his partner Yordanos will collect in the village during the course of the day. Wondachew and Yordanos begin their daily routine by taking the GPS reading for the primary school. Collecting geospatial data is an essential part of the Fund and SCI Foundation supported geostatistical mapping exercise that will help determine the prevalence and intensity of schistosomiasis and soil-transmitted helminthiasis. Before, surveys involved testing large numbers of people. It was a very time-consuming task. However, with this type of survey, people are tested in villages with more manageable sample sizes. This approach helps to target those who need the treatment and potentially save money and conduct treatment campaigns in areas that need it most. The results of the survey will inform the development of the next 5-year national strategy, which seeks to end the transmission of schistosomiasis and soil-transmitted helminthiasis by 2025.
ጠዋት ላይ እንደተገናኘን በጎ ፈቃደኛ ነበረ። ከበጎ ፈቃደኛው ጋራ የቀበሌውን ገጽታ እንዲያሳየኝ አብረን ከትምህርት ቤቱ ጂፒኤስ በማንሳት ነው በጠዋት እየተነሳ ነው። ለዚህ ጂፒኤሱን አንስተን እስከ ቀበሌው ጥግ የግድ መጓዝ ስላለብን በጎ ፈቃደኛ ሰው አግኝተን አብሮን ነበረ። የቆጠርነው 252 ቤቶች ነው። ያን ደግሞ እንትኑ ልክ ጂፒኤሱ እንዴት አድርገን መስራት እንዳለብን የትኛውን ቤት መስራት እንዳለብን በየ3 ቤት ኢንተርቫል ስሩ ብሎናል። አንድ ቤት ገባን። ልክ እንደገባን መጀመሪያ ዙር የምናደርገው ያው ከሰላምታ ባለፈ ያለውን በፈቃደኛነታቸውን ነው የምንጠይቀው። ፈቃደኛ ነሽ አይደለ? ፈቃደኛነታቸውን ጠይቀን የእድሜ ግሩፕ አለ። ኤጅ ግሩፓቸውን ያለውን ነገር ሁሉ ከወሰዱን በኋላ ልክ ያለው ስልኩ ፎርሙን ይጠይቀናል። ፎርማት ስልኩ ላይ ያለ ምን ያክል ስቴፕ መሄድ እንዳለብን ያለውን ሁሉ ካስገባን በኋላ ዳታ ስልኩ በራሱ ጊዜ በዚህ እድሜ ግሩፕ ያለውን እገሌን ውሰድ ይላል። ዋተር ምን እንትን ውሃ ምንድነው የምትጠቀሙት? እንትን ቧንቧ ውሃ ነው ወራጅ? መጠየቁን ከጨረስን በኋላ ልክ በከለር ኮድ አድርገን በቤታቸው ስልኩ በሚለየው ለምሳሌ ያክል አዳልት ከሆኑ በቀይ ከለር፣ ደግሞ በመካከለኛ እድሜ ወይም ከ9 እስከ 14 እድሜ ደረጃ ከሆኑ በሰማያዊ ከለር፣ ከ8 በታች እስከ 1 አመት ያሉ ከሆኑ በአረንጓዴ ከለር በማድረግ እቃውን እንሰጣቸዋለን። እቃውን ሰተናቸው የሰገራ መያዣውን እቃ ይዘውልን ልክ መስፈርት አለው ከዚህ እስከዚህ አድርጉ የምንለው በዛ ልክ ኮሌክት አድርገው አምጥተው ይሰጡናል። ያን ሳምፕል ልክ ኮልድ ቼኑን ኖርማል ሆኖ እንዲመጣ በመጠበቅ አስቀምጠን ወደዚሁ ነው ይዘን የምንቀርበው።
Back at the school, Wondachew and Yordanos hand over the samples to the lab team for analysis. The lab team enter the color and number codes provided for each sample into the mobile devices. After logging all the data associated with each sample, the lab team moves on to prepare the slides for analysis under the microscope. Peering through the microscope, the lab technician uses a palm-held counter to keep track of the incidence of each parasite found in the stool samples. This information is recorded on paper and then entered onto the mobile devices, providing instant updates to survey partners back in London. With the help of technology, survey teams in 8 highly affected districts of Ethiopia have been mapping the prevalence and distribution of intestinal schistosomiasis and soil-transmitted helminthiasis that affect close to 75 million people in some of the most remote corners of Ethiopia. Despite the distress and harm they cause, however, until recently, they have not received focused attention. The Ethiopian Ministry of Health, SCI Foundation, and Fund, the London School of Hygiene and Tropical Medicine, and other partners work together to create an innovative solution of mapping these diseases. The mapping will enable more cost-effective and efficient treatment, really targeting the people that need it most.